No. Yes, it's on. Hi. Good afternoon. Good afternoon after lunch and after a very exciting morning of coming and going. My name is Terry Altilio, and I'm the moderator for this wonderful panel. I'm a social worker, and I work at Mount Sinai, Beth, Israel in New York. We're going to get very focused, so the introductions will be very short. I'm going to take about 2 minutes to say two things that have struck me as I was listening this morning, and also I have stolen something from Kathy Kobler's slide, and I want to share it with you. And this is it. And then I'm going to talk a little bit about horizontal and vertical. Kathy has a wonderful slide, and it's a quote from a parent. And it talks about recognizing shifting goals as babies living unfolds. And I thought how wonderful that quote is. It's not about a life unfolding as babies living unfolds. And I think in part, that's what we are doing. That's what we are doing here today. We're unfolding new ideas. We're sharing new ideas. And in spite of the fact that I really do sometimes wonder about meaning making and meaning taking in the institutional worlds that some of us live in, it is experiences like this that I'm privileged to be a part of that keeps the meaning making going for me. The other thing that keeps meaning making going for me, which I want to share with you, it came to me one day, probably as I was walking or digging in the dirt. That's when I do my best thinking. And it is about horizontal and vertical planes of experience. And part of what I was hearing, and I hope that you will hear or think about hearing it this way, this morning, not only from the program innovations we're talking about, looking at history, the American the Advocate Foundation, looking at history, taking a moment in the present to look at history and plan forward, to me, has to do with horizontal and vertical thinking. So we enter people's lives, we enter systems in the present, and on our better days and in our most meaningful work, we try to understand the history. When you heard about Vin this morning, where's our wonderful chaplain who told us about Vin from Vietnam? Right? When you heard about Vin this morning and the history of this family, when you can take the time to discover that, to unravel that, it takes you to all kinds of different interventions and keeps, for me, the hopefulness. And the other thing that it does is it makes me feel terribly responsible for intervening in the present in a way that I influence the future in a positive way, that the patients and families who leave us don't end up with post-traumatic stress disorder and all kinds of other trauma as a consequence of the care that we did or did not provide or the way we provided that care. So on that note, I'm going to introduce Tony back, who's done an enormous amount of work on communication. We're doing the introductions very short. You can read all the wonderful stuff that all these folks have done who are sitting before you. But right now we're going to take time for the content of what they would like to share.